guys, welcome to this wonderful discussion. So today we'll be talking about something very, very much important. Don't go to anywhere, just watch what I'm sure you're going to gain a lot from this. So we'll be talking about something that is very much important in our society today. Talking about smoking cessation and behavioral approach to smoking cessation. Smoking is something that is very common among youths in our society today. Smoking has no health benefits in our body. Those substances you taking, those substances you inhale has no health benefits. It adds nothing to your body. Instead, it causes more problems to you. Smoking causes a lot of harmful health conditions. It makes you develop different kind of health conditions. Things like lung cancer, heart disease, respiratory disease, so many of them. So I don't see the need why you should continue to smoke. I don't see the need why you continue to smoke. You see why it's very, very important to stop smoking. Smoking cessation is very, very important. So what is smoking cessation? Smoking cessation is a deliberate action for one to quit smoking or stop smoking or quit the use of tobacco products. It's true that quitting smoking is very, very hard. It's not something that is very, very easy to do, no matter regardless of the gender or sex. It's something that is very, very hard to carry out due to something that is related to addiction. So quitting smoking or smoking cessation is very, very hard. That's why support is needed. Yes, that's why support is very, very much needed for smoking cessation to be carried out properly. Support is needed. So what are the behavioral approaches or behavioral intervention to smoking cessation? Behavioral approaches involve changing one's character or pattern of life that clue that person to, or that predisposes that person to smoking, diverting it into desirable behavior and or character that will be beneficial to that individual. That's the behavioral approach to smoking cessation. So how can one carry out behavioral approach to smoking cessation? First of all, that individual needs a support system, either a healthcare provider, a counselor, health educator. The person needs a support system that will help he or she to accomplish that goal of quitting smoking. It's not an easy thing to carry out. So that's why you need support for you to go on the journey of quitting smoking. Well, the number one thing you have to do is you making that decision, you yourself making that decision first that you want to quit smoking. So after you make that decision to quit smoking, you set a quick date. You can either do that yourself, or a healthcare provider or counselor can help you to at least guide you through. So you set a quick date, like this is also day I'll quit smoking. After you set a quick date, you find the need why you should stop smoking. You should see the need, the reasons why you should stop smoking. Smoking has so many health implications. It damages your lungs, it damages your body system. You see reason. Apart from the health implication, you also have social implications. So many implications. The society will not see you as a reasonable person. How about your family? As a father, you're smoking, your children are watching you. Which good example are you saying? You see the reason, you see the need why you should stop smoking. After you see that need, you should have a support system. You should have healthcare providers that help guide you. You should tell your family members about it, both your friends, tell them about your decision to stopping smoking, because it will help you a lot. After you've set your quit date, you've identified reason why you should stop smoking. There's so many reasons. You've gotten your support system. You've gotten a support system. You got your healthcare provider, your family, your friends. You've gotten all these things. Next thing for you to identify trigger. Identify those things that trigger you to smoke. If you identify those things, try to avoid them. Maybe it's your friends that makes you to smoke. Anytime you hang out with your friend, you smoke. You try to avoid them. Try to avoid the environment where they stay. You try to maybe avoid you perceiving it, or you staying alone in a lonely place. Avoid those things that will trigger you to go back to that action. So after you identify those triggers, you're going to do is to replace it with something very meaningful, something that will add to you, something that will add to your health, things that will be beneficial to you. You can choose to be going for exercise, going for vacation, hiking, you can travel, get busy, drink a lot of water, eat healthy, exercise, or you chewing gum to help you to what? Quit that smoking. But some of the behavioral approach to you quitting smoking. Number one, you set a quit date. Number two, you find reasons, need why you should stop smoking. If you've not identified all these things, I don't think you are ready to stop smoking. You get a support system, avoid triggers, then you replace those things that push you to smoke to reasonable things around you, things that will be very, very beneficial to you. So after you've checked all those things, avoid triggers and everything, the time you get to stop. So you see yourself forgetting about that kind of lifestyle. You see yourself doing more things that are more beneficial, things that will make you grow. You see yourself adding more flesh, looking fresh, like today's bread. You see yourself thinking well. So when you do all these things, fine. Get to like reinforce yourself, celebrate yourself. It's not an easy thing. It's not an easy thing to quit smoking. You get to congratulate yourself, celebrate yourself. It's not an easy thing to quit smoking. So I urge you guys, if you are in the act, I advise you to stop smoking. It has no health benefits. Like those substances you are taking has no health benefits to you. Quit smoking is very, very important for your health. It has so many implications. It has so many harmful effects. So why should you continue to smoking? Avoid those substances, all those tobacco products. Avoid it so as for you to live long and healthy and productive in society. Thank you very much for watching. Thank you very much for listening. I hope you find this little discussion very helpful. Thank you and God bless you. So please subscribe if you haven't. Follow, like, and comment. God bless you.